Hello, my name is Rocio Cordon, and today I'm going to be discussing the lack of healthcare access among undocumented immigrants. You may be sitting there asking yourself, why come here illegally? Why not just take the needed steps to gain legal status? Well, this is often easier said than done, as current immigration policies in place are making it more difficult to receive legal status. Because of this, one of two things are occurring. One, immigrants currently residing in the US surpass their stay, or two, immigrants not yet living in the US are finding ways to illegally cross the borders. So for today's video, my population is undocumented immigrants living in the US. Due to the process of gaining legal status being so difficult, the US has seen an increase in undocumented immigrants. And as of 2017, Pew Research estimated that approximately 10.7 million undocumented immigrants are residing in the US, meaning nearly a quarter of the US foreign-born population experiences a lack of healthcare access. So what's making this population so vulnerable? Well, one of the biggest barriers is the exclusion of undocumented immigrants under the Affordable Care Act. Undocumented immigrants receive no federal coverage. This means they are not eligible for Medicare, Medicaid, or CHIP. Due to this, some of them rely on employer-based insurance. However, this population often falls under a low socioeconomic status and holds jobs that do not offer these services. While they are not eligible for public insurance policies, under federal law, they still remain eligible for emergency care and can receive non-emergency health services at community centers or safety net hospitals, which I will be discussing more about later in this video. Though there may be a few services offered to them, many immigrants are not aware of how the US healthcare system works and therefore they are unknown of these services. Another barrier is they have limited English proficiency, meaning even if they were to meet with a physician, they may not have quality communication with them and they might accidentally get diagnosed for something they don't have, or they might forget to tell them a symptom that could lead to a diagnosis. So what are some support systems for this population? Safety net hospitals are one support system. These hospitals are obligated to share basic duty of care to patients who lack healthcare access under the Emergency Medical Treatment and Active Labor Act, or EMTALA. Hospitals will treat patients who come to an emergency department for medical care, and they will not be treated until their condition is stable. Hospitals can then apply to state emergency Medicaid programs for reimbursement. While illegal immigrants are excluded from federally funded insurance programs, providers are not legally required to ask about a patient's immigration status. Therefore, they can initiate medical treatment. Another service is community healthcare clinics. They can receive medical care at a variety of healthcare facilities, including federally qualified health centers, urgent care clinics, public hospitals, and emergency rooms, regardless of immigration status. What are some of the recommendations? While undocumented immigrants can receive healthcare at clinics and urgent cares, they are still responsible for the out-of-pocket costs because their low socioeconomic status. These costs can be high and place a financial strain on the individual. In order to combat this, I believe we should create programs that help alleviate some of these costs, or maybe even allow them to make these costs in payments. Additionally, I believe we should set up more community health facilities and communicate with individuals that they are able to seek healthcare through clinics. These clinics can serve as a form of preventative medicine as individuals are able to seek treatment earlier on instead of waiting for an emergency situation to occur. So here are some of my discussion questions. What changes to the Affordable Cares Act would you make in order to best fit the needs of undocumented immigrants? How would this impact taxpayers? The second question is, how might opening more community health populations impact not only undocumented immigrants, but the US population as a whole? And here are my sources.